Today we're going to talk about aesthetics. TMJ I've talked about a lot, but aesthetics, good looks. So we can look at the screen here, and then it's aesthetics explained. Points of interest to non-dentists. Okay, the old days. 50 years ago, the best looking crowns were made of porcelain fused to metal. Or they had some all porcelain crowns called porcelain jacket crowns that were fragile. Probably only wealthy people got them because they broke often. Partial coverage crowns were made of gold. And people don't like gold nowadays. It's still the best. About 22 years ago, porcelain veneers came along. That's just an estimate, but they were made of porcelain. They all look great, but the weak point of all the porcelain restorations were that they chipped. And as a practicing dentist, it drove me crazy when I would make someone a beautiful crown and they would chip a piece out. And that's just the way it is. That's the way it was. So 20 years ago, we had computerized crowns that were carved out of porcelain blocks. The fit was okay, but the occlusion, the bite, was poor. Today, after many software upgrades, the computerized crowns are well-fitting, and the occlusion is just as good as conventional crowns done by technicians. So the computer age is totally here. Point of interest, 5 years ago, 70% of the crowns made in the US were porcelain fused to metal, the old ones that we're talking about. Today, it's flip-flopped even more. 25% of crowns are done porcelain fused to metal. 75% are done on the computer. So the computer age is here for sure. So the new materials. Lithium disilicate, excuse the spelling, is the most aesthetic material. It is now the most popular material for restoring front teeth. It can be used for full crowns and veneers. It is 2 times more resistant to chipping than the conventional porcelain. The bicuspids and molars can be restored with zirconium crowns, the material used to make artificial diamonds and the Yoshi blade. It is stronger than steel and comes with a lifetime guarantee. Polished zirconia, this is really neat. Polished zirconia has the distinction of being 3 times less abrasive than the old style porcelain. As a practicing dentist, that's highly significant. I've seen so many patients come with porcelain crowns that have destroyed the natural teeth that they were opposing. For implants, zirconia abutments under Emax crowns look great. And that's pretty much the cat's meow now. If you have an implant on the front tooth, you don't get a metal abutment screwed into the implant. You get zirconia. Pricey, but it's the way everyone goes. Okay, now aesthetics, talking about aesthetics. Matching tooth colors. What's this? Is somebody grossed out?
Everybody's done with breakfast, right?
What's that?
Next photo, please.
Keep going. Keep going.
Photos of color guides next to natural teeth are emailed to the dental technicians. Okay, this one is to match the teeth, and this one is to match the color underneath because the color comes through. So if you see some dark spots in there, I'll probably take them out some of it when I deliver the crown, but that slight darkness is going to come through. So the technicians want to know that so they can put a material inside of the crown to block out some of that color. And then when I cement them, I have different colored cements that I can use to put a very fine nuance to the shade. So there are many ways of doing it, and I use them all. But Emax is the best looking. Looks like a tooth. There it is in the mouth. Good looking stuff. Zirconia is the strongest though. This is a zirconia preparation, and this is a zirconia crown. It looks good, not as good as the Emax, not as aesthetic, but no one cares in the molars. Some people, if they smile big and this never shows, they can have a gold crown. But so many people are resistant to having gold in their mouth. It's still the best, still the longest lasting. And as a dentist of 46 years, I've seen gold crowns as the longest lasting restorations in the mouth, period. So when someone asks me, what's going to last the longest, I say the gold crown. And here we are adjusting the bite on the zirconia. It's so strong, I can't use the regular dental materials to adjust it. I have to use diamonds, okay? Now, this is a very good case of someone that I did years ago. Her teeth were really spaced hideously. One was in, one was out, and she wanted more lip support. And I said, what you want is going to be difficult because it's going to look really funny. And she said, I want it anyway. So I did these in composite, and it looks pretty decent. If you wet it, they don't look so bad. They don't look very shiny. But she wore them for 2 years and decided that that was what she wanted. So then we did the shades, matched the colors inside and out, and these are the veneers all in place. So they actually look a lot better, and they're much stronger right here. They're made with all Emax on the chewing surface, the incisal edges. So the question?
I like the
Yeah,
note.
what about the lower teeth there? Could she, are those the lower stuff?
Okay, there's a note on the bottom. Note that the veneers do not match the lower teeth. And the answer is, the patient gets her way. She wanted all the whitest on top. And she paid cash. The day we did the preparation, she paid it all.
She gets it.
And that patient gets whatever the patient wants. That's it. And besides, I know this patient very well. It's a good question. I know the patient very well. If we didn't make, this is the whitest we can get them. If she didn't have it this white, she would complain to me every time she would come in. I wanted it white. I wanted, you know. And so to avoid all the bitching, I said, okay, you get what you want. You get what you want. And by the way, she got what she wanted with her other teeth too. Now this will be replaced someday when she gets over the shock of the cost for these veneers. But actually these match those teeth, which are way too white if you look at the teeth in back. So it's not just being competent in what you do. You have to be competent with working with people and seeing what they want. It's a want. She didn't need these veneers. It's not a need, it's a want. And within that want, she wanted white. So she got white, and she's very happy.
Good.
So that's the way it goes. So this is a good one. This, I brought it up because somebody was talking about missing laterals. This patient was dealt a low blow by Mother Nature. And she was, I think, in her late 40s when I did this in 2000. And she had big spaces and missing laterals. That's how she looked. And I said, you know, this eye tooth should be moved back here. And then we can move the teeth together. And then we can do you know, a bridge here. And do a lot less drilling on your teeth. And her answer was, forget the braces, forget implants, do all crowns instead, because she wanted it now. And she paid for it now. So that's what it looked like. This was not happy. This poor woman, you know, suffered a lot because it really looked terrible when she smiled. And see the missing teeth. And so I waxed it up. I tried to wax to show her what it might look like. Then I waxed the shapes. This broke off because it's 15 years old. And then I prepared the teeth. This is the actual, what they look like when I prepared the crowns. So you have to cheat. You want a space here, you want more space here, you have to cheat. And that's what I did. But this is the result. Wow. See? So, I mean, I knew I could do that because of the wax. Okay? And this is the temporary bridge. Now, I made the temporary from the wax. So she wore this, which she loved, and that's what it looked like. See? She wore that, and she was so happy. And then when we got the bridge, she was really happy because this is the before and after. This is the after when you look this way.
Wow.
Really nice. Okay. And to brag about my technical expertise and fit, this was done 15 years ago. Okay? The American Dental Association says crowns have to last 5 years. If a crown lasts 5 years and breaks or falls out, then that's a successful crown according to the ADA and not according to my standards. I would be ashamed if my crowns only lasted 5 years. And my patients that are here that have crowns know that my crowns last a lot longer than 5 years. So the x-rays show that 15 years later, the bridges are perfect. All different angles show a great fit. This is a technical achievement of a very difficult case. I had to take time to do it. I didn't rush. But this is what it looks like. It still fits. Still fits everywhere. Still fits. Every angle you look at, it fits. Every angle. Every angle, it fits. And this is another one. This is the TMJ case that I reconstructed. I reconstructed her mouth. That's how she looked like the before. That's how she looks now. And actually, 5 years later, she looks younger than she did after I fixed her bite and her front teeth. And the same thing with the front teeth that I did with the patient that wanted her front teeth fixed for looks. I added composite here to her teeth. She wore it 6 months, and then I did her front teeth, so she looks like this. And now she's a cougar. She married a guy much younger than her.
Chris.
Okay, so that's my aesthetic presentation this morning.
Excellent.
Hey,
Any questions?
yeah, that was the best one, man. That was the best one you got.
You like it?
That was the best one.
You like
It
it?
was cool.
Well, that's like, I did it for Crystal. She's not here, but thanks for the thought, Crystal, wherever you are.
Too bad.
David.
Is this the type of work you would recommend for, like for myself, when my baby teeth fell out, the teeth that came back in were still the same size? Is that the similar type of procedure that you would recommend?
Well, if the teeth are too small, you're saying?
Yeah.
Oh, yeah, veneers. You can put veneers on them or crowns.
Okay.
And that would be determined by making models of your mouth and then putting the wax on it, like I did. And we would see what can be done with veneers or what might be better done with the crown. Just depends on each individual tooth. So, oh yeah, it's done all the time. And the new material is much better than porcelain and much less likely to chip. And that makes me feel so good because we have a patient here. See, we can't talk about individuals' work, it's against the law. But we have a patient here that's one of my patients that he's had regular crowns and I've done a EMAX on him. And EMAX really looks good and it has never chipped. So far it's really good.
Excellent.
Okay.
Mark, it seems like all those pictures of the different people showed major gum receding. Is that another issue you deal with, or is it
Oh, no, that's a work in progress. They have to keep coming back, keep getting, but I can't brush their teeth for them.
And
But-
floss.
This is America, we can only suggest. So it would be perfect to have people with perfect gums every time, but in reality, it doesn't happen. But the gal with the bridge, 15 years,
Great.
good gums.